Good afternoon and welcome to Nursing Leadership and Management Class 4827 with Professor Dr. Teresa Dyer Kramer. This is in collaboration with Keila Height, RN, and Anthony Laquadera, RN. The conflict is with a family and a nursing supervisor. The patient was Baker acted after a suicide attempt, and once she was cleared from the emergency department, she was transferred to the psychiatric facility where the father showed up with several members of his motorcycle gang requesting that she be discharged immediately. The family had a 4-week-old baby at home, and he was having problems taking care of the baby. The nurse house supervisor was notified by a phone call to their office, and he reviewed the internal and external videotapes, called his administrators, called the other units for extra staff for assistance, and asked them to come in separately from separate doors and hang in the background so they wouldn't escalate the situation. The father then kept getting very loud. The nursing house supervisor went to the unit, spoke with the charge nurse, reviewed the chart. He also notified the local police department to be standing by and let them know what the situation was, but that he currently had it under control. The charge nurse then took him and introduced him to the patient's husband, and he proceeded to ask the husband if he would go to the nursing office so that they could talk about this quietly and away from the patients. They refused. The patient started escalating, and he pointed that out to the father and his guests, and they agreed that they could go to the supervisor's office and discuss it. They walked off the unit, went up to the supervisor's office, and the husband came into the office with his friends. The nursing house supervisor let him know that he was given consent on the chart to receive all the information and making decisions that he needed to by his wife. But the nursing house supervisor also explained the Health Information and Portability Accountability Act, HIPAA, and that there was sensitive information that may be discussed. It may be very personal, and he might not want everybody privy to that information. So he asked his friends to step outside into the lobby so they could wait. Once they left, the supervisor asked the patient to have a seat, and he sat down in the same chair, in another chair similar to that across from him, and asked the husband what was going on, what were the predisposing factors that led to this, and what could he do to help. The father started to calm down a little bit and was explaining the situation, that he had no family in town and his wife was not speaking to her mother who lived in town, but the relationship has been tense for the last couple of years and they really haven't spoke. The nursing house supervisor let the father know that he understands how difficult it is dealing with a new child, and that he himself had 2 boys that he was raising on his own, and that at first he was unprepared. The father asked the nursing supervisor how he handled it, and the nursing supervisor shared with him that he had to find a support system. He was able to have friends come and help him out, and the nursing supervisor also provided the father with written community resources that he could use to help take care of the child. The husband appreciated that, and the nursing supervisor inquired as to the relationship with the mother-in-law. So he asked if he would reach out to the mother-in-law and they could do a conference call and talk to her, and he agreed. They called the mother-in-law. She was happy to get the call. She reported that she was afraid to reach out to them, and that she would be happy to do anything that she needed to reestablish the relationship, and was unaware that she was a grandmother. So she was very excited. Arrangements were made where she could come and assist with the baby, and the husband was very relieved. After that phone call was ended, the husband asked if he could go and say goodbye to his wife. So the nursing supervisor called back to the unit, informed the charge nurse of what was going on, and if it would be okay if he just brought the husband back, and they said a quick goodbye, and she agreed. The supervisor then took the husband back to the unit and told the husband that he could only go by himself. They went back to the unit. He told his wife, what transpired, and she was very happy to hear that her mother was once again in the picture, and that seemed to bring her a little sense of comfort. And they were then escorted out the front door, both the husband and his guests. Once they left, the house supervisor went back to his office, took a deep breath, called all of his administrators, risk manager, and the police, and let them know that the situation was resolved. The police let him know that they had a car in the front parking lot and the back parking lot standing by in case they needed to intervene, and that they would be sent home and let them go back to their regular route. The nursing supervisor went back to the unit, dismissed his personnel back to their units, and congratulated them and thanked them for, great teamwork. The chart was updated with the information. The house supervisor went over that with the father when he left, and everything turned out to be a win-win situation. The conflict resolution that transpired didn't start when the house supervisor went to the unit. Before the house supervisor ever went back there, he prepared himself mentally. He reviewed the patient's chart. He did his homework, so to speak, and called all of his administrators, extra staff, and the police to have them standing by. The person's incentives were to get his wife back so they could take care of the child. The bottom line was that the wife was not going to be allowed to leave the psychiatric facility under the Baker Act. And the husband was made aware of that. And there were no hidden agendas. He just wanted his wife to help take care of the baby. During the conflict, the house supervisor kept his composure, spoke at a low, calm sort of tone. He communicated very clearly, assertively, and also listened to what the husband had to say. There was no need to take a break as the situation unfolded rather quickly. There was no ridicule, flattery, or helplessness going on, which are the three things that you try to avoid in any conflict resolution. And afterwards, the house supervisor restated the agreement that he would, give a little bit and let the husband go and see her, but she could not leave with him. And then he recognized and thanked his staff. There were several things that you have to watch out for on conflict management. Compromising when each party gives something up that it wants. Competing, one party pursues at the expense of the other party, which would make it a win-lose situation. Cooperating and accommodating, the sacrificing party usually wants something in return later. And something was given back to the father. He was allowed to visit and say goodbye. And smoothing, one party attempts to pacify the other party. In this case, you need to focus on your agreements. And then also there's no avoiding the situation that had to be dealt with. And collaborating. Assertive and collaborating means of conflict resolution usually results in a win-win situation. In this case, it did. In conflict resolution, you need to be aware that there are 3 destructive techniques which were mentioned previously: ridicule, flattery, and helplessness. And this situation ended very well. Everyone was happy. The resources were given to the patient and reestablished connection with the mother-in-law. This will complete the first part, and the next part will be left to Ms. Height, and that will start with part 2, delegation. Thank you.
Hello, my name is Kyla Hecht. I'm going to be talking about delegating tasks to others. I work on a transplant unit, and oftentimes I'll have to delegate to patient care techs, PCTs. The scenario that I'm going to use is we get patients post-op after having transplants. The surgeon will come around and say that they want a patient walked within a certain amount of hours, say 6 hours. So when that time comes, if I'm busy, I will have the PCT walk the patient. The way we do our walking is we have 2 nurses stations. So a lap around will be from one side, the front nurses station, to the back. So we'll say, hey, can you walk the patient 1 or 2 laps around, given how the patient's doing? To ensure the delegation is appropriate, you want to make sure you have the right task. In this case, it will be walking. So walking it will pertain to that patient. The right place, you're in a hospital setting, so this will be taking place in the appropriate setting. The right person, delegating to the right person is important. You want to make sure they are capable of doing the job. You want to have the right direction and communication. You want to give concise directions on what you want done, 1 laps or 2 laps. And you want to have the right level of supervision. You want to give appropriate monitoring and, if needed, feedback. Delegating. You want to identify each necessary skill and education level to complete the delegated task. So whatever you're delegating, you want to make sure that patient has the education level and the skills that they need to carry out the task. You want to plan ahead. You want to make a time that's good not just for you, but for the patient also. Select and empower capable personnel kind of goes with the first one. You want to make sure that person is capable. You want to communicate your goals clearly. Just clearly say what you need done. You want to empower who you're delegating to. You want to empower them, not overpower. Sometimes it seems that the nurse is overpowering, saying what they want done, but it's all teamwork. You want to set deadlines and monitor the progress that is taking place. Monitor the role and provide guidance. If you see that maybe the PCT is not doing something right, you don't want to say, hey, you're not doing that right. You just want to provide guidance on, hey, it can be done this way, or you can do it this way. You want to evaluate them. It's important to evaluate people because you don't know if you're doing something wrong if someone doesn't tell you. And always reward accomplishment. Even if it's a good job, thank you so much for doing that. Saying thank you can go a long way. 3 delegation errors. So you have under-delegating, over-delegating, and improper delegating. Under-delegating can happen from an individual's false assumption that delegating may be interpreted as a lack of being able to do the job correctly on your own. Over-delegating can be due to poor time management. You might have a million things you need to get done and you're just giving half of your list away because you can't get it done all on your own. And this can cause a burden not only for you, but who you're delegating to also. It can also happen from feeling insecure in your ability to do the task. Maybe you haven't done this task in a very long time, such as putting a Foley in, and you're just not really sure. It's been years since you've done one, and you hand it off to your PCT, and it's just you can't do the task. So you just want to make sure to not delegate for the wrong reason. And you have improper delegation, which can be delegating the wrong time, the wrong person, and the wrong task. Say you delegate the PCT to collect lab work and they're not skilled in that, they're not able to, they don't have licensing to do that. Creating a healthy work environment. So there are 6 standards to establishing and sustaining a healthy work environment, which is true collaboration, effective decision-making, appropriate staffing, meaningful recognition, authentic leadership, and skilled communication. I think I said that. Components of a healthy work environment is everything I just said. So what makes my current work environment healthy? My current work environment, they have very good leadership, communication. Our staffing, I think everywhere might have staffing issues every once in a while, but they really focus on making the nurses and the techs happy with the staffing, and they don't try to overwork us. And the teamwork. Teamwork goes a long way, especially if you have a really difficult patient and you just have backup with you. Just ask if you need help. It matters. And professionalism. I think maintaining a professional work environment is very important.